Good evening, friends. Good evening, friends. I'm Dr. Aajay Shah, and I'm bringing you another Facebook Live tonight. Tonight, we are going to continue on our diabetes seminar. Tonight will be segment 3 and segment 4. So we have covered this diabetes seminar last Saturday as a one whole segment. Now I'm breaking down into 2 segments at a time, so you can watch it 2 segments at a time. This segment 3 and 4 will be on YouTube, so you can watch it multiple times if necessary. But join me tonight on diabetes seminar segment 3 and 4. But before I start on diabetes, I like to say a few things about. One of our follower, one of our actually friend asked me today that, Dr. Shah, how do you find time to do all this thing? So let me tell you my day today. How did my day go? I woke up around 6 o'clock in the morning. I left for work around 6:40 or so. I worked until about 4:30. I drove home. After driving home, I walked for 2.5 hours. I already have about, you can see on my watch, I already have about 19,000 steps already. So I take my exercise very seriously. I eat pretty healthy, whole food, plant-based food, drank a lot of water. I slept about 7.5 hours last night. I'm doing this live, which will take me about an hour or so total time. So I'll be done around 9 o'clock, 9:15. Then I'll walk again for about half an hour. I'll spend time with our daughter and my wife. So I will have a very productive day. When I drive, which takes me total 2 hours of commute, I typically listen to learning videos. Like right now, I'm listening about weight loss and obesity talks. I'm giving a major talk on obesity and weight loss in about 2 or 3 weeks. So I'm preparing for that weight loss and obesity talk. Just like I prepared for diabetes, it took me about 3 weeks. For diabetes, I almost read about at least 5, if not 7 books. I read a textbook of diabetes. I also watch about probably 50 to 75 hours of videos on YouTube and many other channels. So again, I take all these seminars very seriously. I obviously learn for myself. At the same time, I also want to teach you, because when we learn together, when we teach each other, from our experience, from our knowledge, we grow together and become healthier together. So again, I take this Facebook Live very seriously. This is the way how I spend my day. I have, I have 3 missions. Provide service to my cardiology patients at my work. Provide service to my employer, Oakland Hospital. Provide service to my family and my parents and my wife and my kids, and also provide a big service to my Facebook community and my other social media community, because I've taken this mission of making everybody healthy, as much as possible. So I take all these things seriously. I don't watch any news. I probably get CNN maybe five minutes a day. I get my news by CNN app. I read probably 5 minutes of news. I don't watch Netflix shows. I don't watch movies typically, and once in a while, once a weekend, once in a while I watch it. So I try to be as productive as I can for my mission, and that's how I accomplish so much in a day. I pretty much pack my day with all the great productivity. Again, not bragging, but at the same time, I sincerely feel that same thing applies to health. If we are very organized, if we take our health very seriously, if we take our health as a mission, we all can be healthy. If we take time to cook healthy food, if we take time to go healthy grocery shopping, if we take time to sleep 7 to 8 hours, if we take time to exercise, we can be healthy. So again, anything in life, we have to be organized, we have to be serious, we have to be with purpose, we have to be knowledgeable, we have to learn from each other, we have to learn from books, we have to learn from videos. We have to do that. So this is where my life is right now. I hope it motivates you. It definitely keeps me in check and makes my day go fast. So that's the first thing I want to cover. Second thing I want to cover is that we are starting this health coaching program from July 1st. We made some graphics today. We posted on our Facebook page. To be honest with you, in this health coaching program, I have zero profit. Whatever the cost is going to be to produce this program, including the cost of an employee, cost of producing certain material, cost of getting a malpractice insurance, cost of, just essentially running the program is all I'm going to collect from the people. I'm not going to make a single dollar from this program for myself. If anything, all my time to set up this program is going to be a service to the community. So my time will be all essentially donated towards this program. Again, no extra profit for me or for anybody. It's all community-based program. I have to charge some money because it's going to cost me to hire an employee. I already have hired one employee, which I'm covering costs from my pocket. But now as we grow, I need to at least break even if I don't make any profit. And definitely my time itself is all free time, all the coaching I'm going to provide 2 hours a week on a Zoom call. Our coaching program is going to involve Zoom call with me, which will be a group Zoom call with question and answers on a live way once or twice a week. That will be all free to everyone who gets this coaching program. So again, great program, very cost-effective program. Look up on our Facebook page. We posted it today. I will post it every day for next few days. If you are interested, please reach out to Hannah. Her number is on the graphic, and we will get in touch with you. I definitely invite you. I definitely recommend you. I definitely promise you, assure you that it will be worth your small amount of money. Typically, health coach program would cost at least 5 times more than what we are providing the cost for. So again, please reach out to us if you are interested. Thank you. So let's get on with diabetes segment 3 and segment 4. So again, this is a talk on diabetes. If you have not watched segment 1 and 2, it's already on YouTube. So please watch the segment 1 and 2, and then come back to segment 3. If you want to watch the whole seminar, it's also on YouTube as a whole seminar, all 13 segments. If you're driving or if you got 4 hours of extra time on a weekend, if you want to watch the whole thing in one segment as all 13 in a row, then you can do that. Otherwise, this segments will be 2 at a time. So segment 1 and segment 2 already has been on YouTube. So please watch them. This is segment number 3. So again, I'm going to show you in this segment how our diet has changed over the last 40 years and how the type 2 diabetes has become so rampant. Again, how our diet has changed. So again, to give you quick summary of the whole segment, it's not the fat. It's not the carb, it's the fat actually. Again, it's not the carb. Most people think that the carb led to type 2 diabetes, but it's not the carb, it's the fat. And I'm going to prove it to you. So again, it's not the carb, it's the fat which led to type 2 diabetes. So hang in there and watch what I have to say. Let's start with Japan. In Japan, diabetes prevalence was less than 2% before 1980. In Japan, again, type 2 diabetes prevalence was less than 2% before 1980. So let's see what they ate before 80. So in Japan, they ate carbohydrate about 400 grams in 1955. And since then, the carbohydrate has come down to less than 300 grams. So again, remember, carbohydrate has come down in Japan from 55 to 94. So again, carb has come down. In terms of fat, in Japan, fat almost tripled between 55 and 94. So again, carb came down and fat went up. So intuitively, one would think that as the carb has come down, diabetes would happen less because carb has come down. But if you see in the next slide, as the carb has come down and as the fat has gone up, diabetes in Japan almost quadrupled, almost 4 to 5 times. So again, it's not the carb, it's the fat. As we started eating more fat, and I'll show you in America also, as we started eating more fat, as we started going away from complex carb, whole food, plant-based diet, in Japan, before 1960, 1965, in 55, most people ate whole food, plant-based, a lot of sweet potatoes, a lot of complex carb. Now in Japan, people eat a lot of fatty food, a lot of westernization of diet, a lot of animal products with a lot of saturated fat, a lot of simple carb and sugar, white rice, and white bread. Matter of fact, in Japan, before 1960, a lot of people ate white rice. So even though I don't recommend white rice itself probably is not as bad as saturated fat. I recommend brown rice, obviously, because of the fiber content and many other benefits, but definitely white rice in Japan did not lead to much diabetes. So again, it proves that it's the fat in the diet. Let's talk in America. Meat has gone up significantly. Fortunately, over the last few years, meat has stabilized. Now we don't eat more meat than we used to. But if you look at from 1920 until now, we've been eating a lot more meat. And meat obviously packs a lot of saturated fat, and I'll prove it to you that it's the fat in the diet which leads to type 2 diabetes, not the complex carb. This is a chicken. Again, chicken also has a lot of saturated fat. Chicken intake in America has gone up exponentially. Exponentially. You can just see chicken keep going up every year after 1940. And this is again cheese. Cheese also has a lot of saturated fat, a lot of salt, a lot of calorie dense food, a lot of other, estrogen, other things. And cheese, again, intake, cheese eating also has gone up exponentially. We are almost eating 10 times more cheese than 1900, 10 times more. So that obviously has led to type 2 diabetes. And again, this is the type of food we eat now. A lot of processed food, a lot of wheat thins, a lot of 7-Up, a lot of Coke, a lot of Mountain Dew, a lot of Cool Whip, a lot of Oreos, a lot of Gatorade. So a lot of processed food. If you go to any grocery store right now, the fresh fruits and vegetables are the smallest section actually. Most sections in our grocery store occupies factory-made food or processed food. And that's the reason I'll show you how type 2 diabetes has gotten worse. So why do we have fat in the diet? That's because what we eat. In America, we eat 65% processed food. 65% of our calories come from processed food. And that processed food has a lot of fat, a lot of sugar, a lot of simple carb, and no fiber. Because a food industry knows it's the fat, sugar, and the salt which are addicting. So every processed food has those three things: fat, sugar, and salt. If you look at the animal products, even the leanest beef has a 29% fat. 29% of the leanest beef calories is fat. Even in the skinless chicken breast, 23% is fat. Even in fish, it varies from 15 to 30%. So again, all animal products carry significant amount of fat content in terms of calories. But on the other hand, if you look at the whole farm-raised food like broccoli, beans, rice, sweet potato, it's typically less than 5% of calories come from fat. So again, the way we are eating more animal products, more processed food, our fat content has gone up. Many people tell me and make me believe that our fat content has gone down in the last 30 years. True, it's gone down by 2 or 3% in terms of total percent calories, but overall fat gram has gone up. Overall fat gram in our diet has gone up because we are eating more calories. So even though percent-wise, fat is about 28, 30%, because of the All-American Heart Association push over the last 30 or 40 years, fat percent has gone down, but fat in grams, like total number of grams of fat in our diet actually has gone up, because as we are eating 500 more calories, we are eating more fat. We definitely are eating less percent fat of our calories, but we are eating more grams of fat in our diet. I hope you understand what I'm trying to explain you. So again, we are definitely eating more grams of fat, and that's the reason type 2 diabetes has gone up. So other reason for type 2 diabetes is sedentary lifestyle. But as you can see that 75% of Americans don't get the recommended 150 minutes of physical activity. So again, as American, we don't exercise enough. To give you an example, 10,000 steps per day is the recommendation. For example, today I got 19,000 steps already. My average for 2020 is about 21,000 steps. So I definitely get my physical activity done, but I know many Americans don't get even 4,000 steps, 4,000 even steps. And again, you can see on this graph, 75% of Americans don't get even 20 minutes of exercise per day. 20 minutes of exercise. 75% of Americans don't get 20 minutes of exercise. But you can see at the same time that since the last 15 years, we are not exercising less at least. So people who are exercising have continued exercising. People who have not exercising are not exercising right now. But at the same time, physical activity itself has been flat. So again, it's our diet. Physical activity has been flat. So it's our diet which has led to obesity and type 2 diabetes. This is a famous slide. I've seen this slide for 15, 17 years. As you can see that as these people are going to the fitness club, they are taking the escalator. This is the sad story about America, about the Western world, where we have fast food, we have fast cars, we have vending machines, we have escalator, we have elevators, and we are essentially becoming a fast society. And that's partly the reason we are becoming obese. We are getting all stressed out. We are having a lot more mental disorders. We are on multiple medications. We are living less for the last 3 years. So this needs to change. Other type 2 diabetic risk factors are high triglycerides, which is the type of fat in the blood, and low level of HDL, which is a good cholesterol. Other thing is a metabolic syndrome, which we will cover as we go. Metabolic syndrome is essentially pre-diabetes, and that can lead to diabetes. Certain ethnicity also can lead to type 2 diabetes, particularly American Indians, Indian Americans like myself, African Americans, and Hispanics. That we will also cover also as we go. So again, if you are from this ethnicity, you are at a high risk of developing type 2 diabetes. At the same time, I must say that it's not the genes of ethnicity, it's the environment, it's what our lifestyle is. So typically, if you look at the lifestyle of American Indians, what they eat, how much exercise they do, a lot of Indian Americans, even a lot of Indians in India, a lot of African Americans, a lot of Hispanics, it's what they eat and how much exercise they do. Again, genes do play a small role, but the large reason these ethnic people get type 2 diabetes is because of their lifestyle, because of their behavior. So don't cop out that I have bad genes. You can turn off your bad genes. You can turn off your bad genes. And I'm sure you know that's called epigenetics. Epigenetics is actually now proven to be more important than genetics itself. Epigenetics means essentially how your environment, how your behavior, how your lifestyle is going to affect your genes. So if you have a healthy lifestyle, you can turn off your bad genes and you can turn on your good or healthy genes. So again, don't worry if you got your parents with diabetes. You can definitely defeat the type 2 diabetes. So it's going to be a lifestyle which is going to prevent type 2 diabetes, not your genes going to cause the type 2 diabetes. The other type 2 diabetes risk factors are polycystic ovarian syndrome, which is typically obviously in the women. So if any woman has a polycystic ovarian syndrome, they're at risk of type 2 diabetes. Having a gestational diabetes for women, a diabetes during pregnancy also predispose you to having a type 2 diabetes. Having family history of diabetes increases your risk by 3 times, 300%, 3 times. But again, like I said, it's partly due to genes, but mostly due to the common habits, common lifestyle we share with our family. Parents who eat a lot of simple carb, eat a lot of sugar, a lot of fried food. Typically, kids eat the same thing, and that's the reason everybody in the family develops type 2 diabetes. So again, family history, mostly because of the habits we share, small part because of genes. As we get older, I'll show you the slide. As we get older, we are at risk of developing type 2 diabetes. A high visceral fat, which is a fat around our organs in the belly, having a high amount can also predispose you to type 2 diabetes. Having low muscle mass, which we'll talk also about it, can also lead to type 2 diabetes. As you know, muscle is the biggest utilizer of sugar, of glucose. So if you have low muscle mass, that's when you don't utilize your sugar well and you start having type 2 diabetes. So developing insulin resistance in muscle is also very important. So again, weight training also will become important. As we go in this seminar, I'll show you in our exercise section how you can maintain the muscle mass. Again, genes play a small role, like I said earlier, in development of type 2 diabetes. It's mostly our lifestyle. Again, in family history, it's our shared lifestyle or shared habits which leads to type 2 diabetes and small role of genes. Why aging and insulin resistance or aging and type 2 diabetes happens? Because as we get older, we have a less muscle mass. Like again, I said, muscle is the biggest utilizer of sugar. We have high body fat percent and more fat cells, which also leads to type 2 diabetes. I'll show you the mechanism for having more fat cells leading to type 2 diabetes. We have at times less efficient mitochondrial function that also will lead to less energy utilization, and that can also lead to type 2 diabetes. As we get older, physically we are less active. That can also lead to insulin resistance and type 2 diabetes. And as we get older, we have a loss of beta cells, beta islet cells in our pancreas, and even the efficiency or the function of beta cells goes down, and that can lead to less secretion of insulin, and that can lead to type 2 diabetes also. And as we get older, obviously cooking becomes an issue because older people at times have difficulty in grocery shopping, difficulty in cooking on a regular basis, and they reach out for many processed food. They reach out for many microwave dinners, and all those processed food, microwave dinners, and ready-made food are very high in sugar, very high in saturated fat, very low in fiber, and that can also lead to type 2 diabetes. So again, as we get older, in my opinion, there's a perfect storm of this quad cycle hypothesis, which I'll show you what it means. Essentially, it means we start to develop resistance in muscle, liver, pancreas, and effects of the fat cells. So again, there is a 4 parts or 4 organs working together to create a perfect storm of type 2 diabetes. So as we get older, remember, we are all at risk of developing type 2 diabetes. Obviously, we cannot stop getting old. We all are going to get old, but physiologically, we can stay young. I've seen many of my patients, and I definitely have read a lot of those blue zone people. Blue zones are the people where people get old, but physiologically, they stay young. Means their body is young, even though chronologically, they are old. So I've seen many examples of 100-year-old with a 40, 50, 60-year-old body, and they are the one who will not have type 2 diabetes. So again, don't think that aging itself will lead to type 2 diabetes. It's how we gracefully age, how we take care of ourselves, whether which will prevent the type 2 diabetes or not. So what are some of the emerging risk factors for type 2 diabetes? Definitely sugar-sweetened beverages, even including some energy drinks like Gatorade, even definitely some juice like orange juice, they all can lead to type 2 diabetes. So I definitely ask you to avoid all sugar-sweetened beverages. Definitely high fructose corn syrup, like in Coke or many other soft drinks, can also lead to type 2 diabetes, which we'll cover as we go. There's also some data that people who sleep less than 5 hours, they're at risk of developing pre-diabetes and diabetes. So definitely 7 to 8 hours sleep is important. I will cover the sleep as we go in the seminar, but definitely short sleep duration is a risk factor for developing type 2 diabetes. Even we have seen that night shift workers, people who work night shift also have a high chance of developing type 2 diabetes. This is a slide on high fructose corn syrup. As you can see, as the high fructose corn syrup consumption has gone up, obesity clearly has gone up. There's also a lot of other effects of high fructose corn syrup, including fatty liver, because as you know, fructose can only be metabolized in the liver. And when fructose goes in the liver, if there's excess calories, if there is excess fructose, that fructose can turn into fatty liver. So again, that's the reason fatty liver leads to insulin resistance in the liver cells, and that can lead to type 2 diabetes. So again, this is a role of high fructose corn syrup in soft drinks. Fructose in the high fructose corn syrup can only be metabolized in the liver, and that can cause fatty liver and then liver insulin resistance. And as the liver insulin resistance happens, person will develop type 2 diabetes. So again, these are some of the dangers of high fructose corn syrup. It can lead to weight gain. It's an empty calorie. It can lead to even cancer. Like I said, it can lead to fatty liver and liver stress. It can lead to increased cholesterol level, particularly increased triglyceride level. It can lead to increased blood pressure. It can increase your heart disease risk. It can obviously cause type 2 diabetes. It can even affect your microbiome, which are the good bacteria in the colon, and that can lead to leaky gut, and it can also lead to mercury poisoning. So definitely high fructose corn syrup is no-no. My last soda, my last Coke was 3.5, 4 years ago. I hope you all are quitting drinking soda also. There are other emerging risk factors, including depression. People with depression are at risk of developing type 2 diabetes. And as we have also seen, the people who have type 2 diabetes also have high chance of getting depression. So both chicken and the egg, depression leads to type 2 diabetes, and people with type 2 diabetes have a higher chance of getting depression. Certain toxins can also lead to type 2 diabetes. Even low birth weight can lead to type 2 diabetes. So again, ask your mom or ask whoever can answer, what was your birth weight? If your birth weight was less than 5 pounds, probably less than 4 pounds, you have a very high risk of developing type 2 diabetes. Even poor maternal health during the pregnancy can also lead to type 2 diabetes in the offspring. So definitely ask your mom or whoever can answer that question, that how was the health of your mom when she was pregnant with you. So again, poor maternal health also plays a role. Maternal obesity. So if your mom had obesity during the pregnancy, then you can also have high risk of developing type 2 diabetes. If your mom had a gestational diabetes, you also have a high chance of developing type 2 diabetes. And there are many medications which can also cause type 2 diabetes. We'll cover that, including steroids and many other blood pressure medications. Again, next type of diabetes is gestational diabetes, which happens during pregnancy. Obviously, I'm not the expert on it, but one should be aware that diabetes can happen during the pregnancy. And there's a diabetes called diabetes 1.5, which is essentially a autoimmune diabetes in adult, where insulin production is less or sometimes no insulin production. And that's typically due to destruction of beta cells. They do have some insulin resistance, but it's mostly the destruction of beta cells, which leads to no insulin secretion or low insulin secretion. So again, if a person develops insulin requiring diabetes in 30s and 40s, make sure that there is no diabetes 1.5, or we call LADA, latent autoimmune diabetes in adults. If that's the case, checking C-peptide level can help. I'll show you what the C-peptide means. You should know what the C-peptide means. There are a lot of YouTube videos on C-peptide. If you have type 2 diabetes, or for example, if you have any diabetes, you should definitely read about C-peptide level. I'll explain you what the C-peptide means. There are other types of diabetes. For people who drink a lot of alcohol can develop pancreatitis, and pancreatitis can lead to type 2 diabetes. There are many drug-induced type 2 diabetes, like beta blockers, which is the blood pressure medicine, thiazide, which is a type of a water pill or a diuretic, dilantin, which is a seizure medication, a lot of the steroids like prednisone, alpha interferon, and pentamidine. They all can cause type 2 diabetes. Infection can also lead to diabetes, including rubella and CMV infection. Some of the other hormonal disorders, including acromegaly, Cushing's disease, glucogenoma, and pheochromocytoma. Obviously, you don't need to worry about remembering these names, but remember that there are many conditions which can lead to diabetes. Let's talk about prediabetes, because prediabetes is becoming very prevalent in America. Prediabetes essentially is the one which happens before type 2 diabetes. Prevalence of prediabetes in America is as high as 50%, even possibly 55, 60%. And 50% of prediabetic will lead to type 2 diabetes in 10 years. Many people are pre-diabetic in America. I myself was pre-diabetic 4 years ago. My A1C was above 5.7. It was 5.9. Any A1C is the average of sugar over 90 days. My A1C was 5.9. So it was above 5.7. That means I was pre-diabetic. Since then, I lost significant amount of weight. I exercise regularly. I sleep 7 to 8 hours. My A1C now is 5.2. I reversed my pre-diabetes down to completely normal range. You can do that too. The risk factors for pre-diabetes is the same as risk factors for type 2 diabetes. So how do you find out whether you have a pre-diabetes or not? Pre-diabetes is also called metabolic syndrome, which typically have high blood pressure, fasting blood sugar above 100, triglyceride, which is the fat in the blood, above 150, HDL, which is a good cholesterol, below 40 in male and below 50 in female, and waist diameter above 40 inches in male and about 35 inches in female. If you have 3 out of 5 criteria, that means you have pre-diabetes or metabolic syndrome. So you all should know whether you have pre-diabetes or not, because if you have pre-diabetes, you have 50% chance of becoming diabetic in 10 years. So make sure you know your blood pressure, you know your sugar, you know your triglycerides, ask your doctor, you know your HDL, the good cholesterol, ask your doctor, and definitely measure your waist diameter and know whether you have pre-diabetes or not. So how expensive the diabetes is? Diabetes is an expensive disease, about $327 billion cost to our country per year, 3 times more than non-diabetic. So once a person develops diabetes, it's very expensive. For diabetic, average cost is $13,000 to $15,000 per year. 13 to 15,000 per year. So it's an extremely expensive disease. For a diabetic, it costs $1,000 a month. And the reason I said that, because, for example, we are setting up a program, a coaching program for type 2 diabetic to reverse diabetes, to cut some of the medications, to cut the insulin, even go off medications. And that's going to cost probably $50 to $100 a month to reverse it. You'll be able to go off many expensive medications. You'll be able to lose weight. You'll be able to prevent many complications, which we'll cover as we go in the seminar. You'll be able to live long, because average diabetic lives 10 years less. You have seen my slides before. Average diabetic lives 10 years less than a non-diabetic. So again, if you reverse the diabetes, if you prevent the type 2 diabetes, you can save a lot of costs, you can save a lot of complications, you can save a lot of suffering, and you can actually live long. So again, our program, in my opinion, is one of the most cost-effective programs to reverse the type 2 diabetes. So look out for our program. Again, cost of diabetes has gone up. If a person with diabetes has complications, it can cost up to $24,000 a year. $24,000 a year. That's a $2,000 per month expense for type 2 diabetic with complications. So again, diabetes is very expensive. Reverse it by all means and prevent it by all means. Again, this is a slide summarizing the cost. Lifetime cost of diabetic is $100,000. Again, listen to this number. Lifetime cost of diabetic is $100,000, $100,000. And Medicare spends $100 billion for diabetes. So again, very expensive disease. Reverse it by all means. Reach out to our diabetes coaching program, and we can definitely help you to save a lot of money, because it's going to cost you $100,000 in your lifetime if you're type 2 diabetes. Again, let's finish this segment with some reflections. Do you have type 2 diabetes? If you have type 2 diabetes, what is your A1C, which is a 90-day average? Do you know what A1C means? Would you like to reverse your type 2 diabetes? If that's the case, please reach out to our program. Do you know if you have pre-diabetes? If you don't know whether you have pre-diabetes, ask your doctor for all the 5 things I showed you. And what is your body mass index? Body mass index is very important to know. You all should be able to calculate your body mass index just by going an online calculator. So know your body mass index. And my last reflection to you for this segment is, do you think it's a simple carb, processed food, and excess saturated fat in our diet and excess calories, which leads to obesity and type 2 diabetes? I showed you the example of Japan. I showed you the example of what we eat in America. So again, it's not the carb. If you eat whole food, plant-based diet, like brown rice, like sweet potato without oil, like just cooked and boiled sweet potato. If you eat a lot of vegetables, if you eat a lot of fruits, cooked without oil, I can assure you, I can guarantee you, you will not be obese. You will not develop type 2 diabetes. Again, that brings to the last slide. Actually, one more slide. Let's count what risk factors do you have. So as you are watching this thing, just count the risk factors you have. Do you have obesity? That means, do you have body mass index above 30? Are you overweight? That means, is your body mass index about 25? How much exercise do you have a sedentary lifestyle? Do you have certain dietary factors like eating a lot of processed food, a lot of animal product, a lot of high fat food? Do you eat a lot of simple carb like white rice, white bread, a lot of cookies, a lot of cake, a lot of bagels? Do you have a high blood pressure? Do you have a high triglycerides and low HDL, which is top of a fat in the blood? Are you from certain ethnicity like American Indian, Indian American, Hispanic, African American? And if you are women, did you have diabetes during pregnancy? And if you have family history of diabetes, again, you are at high risk of developing diabetes. And again, if you are above age 65, you're very high risk of developing type 2 diabetes. Again, I covered in my previous slides, after age 65 in America, diabetes is 1 in 3 to 1 in 4. Very high chance of diabetes after age 65. So this covers the last slide. This slide teaches you or shows you about our health coaching program. It's already in our Facebook page. We posted it today. We'll be posting it every day for next few weeks. If you are interested, look at those pages. Definitely one of the very most cost-effective program. If you have type 2 diabetes, if you're pre-diabetic, this is, in my opinion, one of the most cost-effective program. It's going to definitely get you off many medications. It will save you the money by 1 month or 2 months. Definitely save you a lot of complications. Like again, I said, I'm not making a single dollar in this program. I'm doing it cost to cost, just as a service to community, because that's my mission, to help as many people as I can. So again, this is the end of segment 3. We'll be continuing on segment 4 on today's Facebook Live, and we'll cover Facebook segment 4. Again, if you are on live, please share with your feed so other people can join on this live. Definitely share our page. Invite your friends and family to like our page. We are also on Instagram. We are also on YouTube channel, Healthy Living with Dr. Aajay Shah. Subscribe to our channel. We already have about 25 or 30 videos, 50 videos almost. Watch those videos, different topics about healthy eating, exercise, sleep, even happiness, even stoicism, even on fiber, a lot of different videos, so even high blood pressure. So watch those videos, have comment, have your likes, have your questions, and I'll definitely answer all your questions and all your comments. Let's go to segment 4 now. Again, this is segment number 4. We covered the segment 3. Let's go to segment number 4. So what is the pathophysiology of type 2 diabetes or any diabetes? So we have pancreas as an organ. Pancreas has islet cells, alpha islet cells and beta islet cells. Beta islet cells secretes insulin, which is the most important hormone, which we'll cover, and alpha islet cells secretes glucagon. What are the actions of insulin? Again, insulin is very important hormone. Essentially, insulin gets your sugar in the cell. It gets the sugar in the cell, and that's where it makes glycogen. Glycogen is a storage molecule for glucose. So again, insulin helps the sugar to go in the cell and create the glycogen synthesis or glycogen production. So in the liver, it helps to make the glycogen. It also makes protein. It also makes fat. So again, insulin makes glycogen, which is a storage molecule of sugar. It makes protein and it makes fat. Same thing happens in muscle. It helps the glucose to go in the muscle. And again, in the muscle also, it helps to make glycogen and protein. Again, same with the fat cells or adipose tissue. It gets the glucose in the fat cells and it helps the production or fat synthesis in the fat cells. Again, actions of insulin are very important. This is again a picture of the insulin actions. Essentially, things you need to remember is that insulin gets the sugar or the glucose in the cell. It facilitates the entry of the glucose in the cell. And then that glucose converts either into glycogen or in the fat. It also helps to synthesize or produce protein, and it also helps to produce fat. Again, this is the simple action of insulin, how the insulin works. So again, insulin comes and attaches to the insulin receptor, and there are certain changes in the cell, and that will lead to change in the glucose receptor, and that way glucose will enter the cell. So what is the mechanism of insulin resistance or type 2 diabetes? This is going to be some of the most important slides I'm going to cover. If you have type 2 diabetes, watch next few slides very carefully. Watch next few slides very carefully if you have type 2 diabetes. So insulin resistance happens because fatty acids gets in the cell. So again, remember, fatty acids gets in the cell because when we eat high fat diet, when we have excess calories, when we have excess fat cells, that means we have obesity, there are a lot of floating around fatty acids in the circulation. And this fatty acid gets in the muscle cell because fatty acid does not require any hormone to get in the muscle cell. So fatty acid gets in the muscle cell. That's how the insulin resistance starts in the muscle. And the first effects of insulin resistance is seen in the muscle cells. So fatty acid gets in the muscle cell and does not allow sugar to get in the muscle cell. And that's how the muscle cell resistance starts. This is the most accepted theory. Again, fatty acids getting in the cell, making the insulin receptor not work properly, leading to insulin resistance, not allowing the sugar to enter the cell. So remember, fatty acid in the cell. So how does the fatty acid in circulation happen? It's because we eat a lot of saturated fat, We have a lot of floating around fatty acids from a high amount of fat cells or obesity. We also have a lot of fat coming from the liver. So again, we need to prevent that fatty acid in the circulation so they don't get into the different cells, including muscle cells. It also, type 2 diabetes also can happen because of inflammation. And this inflammation happens because a lot of the cytokines, which we'll cover, are secreted by fat cells. A lot of the inflammatory hormones and markers are secreted by the fat cell that can lead to inflammation, which can lead to insulin resistance. There's also a lot of oxidative stress, which we'll also cover also. And as type 2 diabetes progresses, there is a death of beta cells, beta islet cells in pancreas, which leads to less secretion of insulin, or many times no secretion of insulin, which can also lead to type 2 diabetes. So again, the main reason type 2 diabetes happens because fatty acid gets in the cell. So again, the reason fatty acid can get in the cell, because fatty acid do not require insulin or any other hormone to get in the cell. As soon as concentration of fatty acid in the circulation goes high, it can get into cell and can cause insulin resistance. So remember, it's the fat. So first step is entering of fatty acid into the muscle cell. This is the first step in the insulin resistance or type 2 diabetes, and that's entering of fatty acid into muscle cell. So earliest defect is the decreased glycogen synthesis in the muscle. As the fatty acid gets in the muscle cell, it does not allow insulin to work properly. It does not allow the blood sugar or the glucose to enter the muscle cell, and that prevents the glycogen synthesis. That leads to excess sugar in the circulation. You can imagine, because now the glucose or the sugar is not able to get into muscle cell, so more sugar is floating around in the circulation. This sugar goes to liver, and in liver, this sugar converts into fat because insulin is causing lipogenesis. So that's the reason insulin leads to more fat production. That also can lead to excess fat accumulation in the fat cells, and fat cells keep increasing more fatty acids, and thus fatty acids keep getting into all the cells of the body. So again, why the fat cells are bad? Obesity obviously can lead to many complications, including diabetes, including cancer, including heart disease, including stroke, including many other issues, sleep apnea, arthritis. I will be covering a talk on obesity and weight loss in about 3 weeks, so please stay tuned. But let's see what the fat cells can lead to. Fat cells can secrete free fatty acids, like we just talked about it, free fatty acids that can lead to high cholesterol levels, high fat levels, and that can also lead to insulin resistance. Fat cells can also secrete many cytokines like TNF-alpha, interleukin-6, MCP1, that can also lead to type 2 diabetes and insulin resistance. It can also secrete angiotensinogen, which can also lead to high blood pressure. It can secrete PI1, which can lead to many clotting disorder. It can also lower the secretion of adiponectin, which can also lead to insulin resistance. So again, fat cells definitely are not good for you. So again, this is the twin cycle hypothesis, and I'll tell you what I feel. Twin cycle hypothesis is a very famous hypothesis. Essentially, what it happens that there is a insulin resistance in the liver cells because of the positive caloric balance, positive caloric excess, which leads to, like I said, muscle insulin resistance, free-floating glucose in the circulation that can lead to increased liver fat and can eventually lead to insulin resistance in the liver. There's also a pancreatic cycle where insulin resistance and fatty acid deposits into the beta islet cells that also lowers the efficiency of the beta islet cells, and it can also lead to inflammation and eventually death of the beta islet cells. So this is a twin cycle hypothesis. You can read the slide, but in my opinion, this is a quad cycle hypothesis. I'm not saying described this way. This is like my own way of describing it. It's called quad cycle hypothesis. What happens in quad cycle hypothesis is that initially the muscle cells become insulin resistant because of the free fatty acid in the muscle cell. Then it leads to liver insulin resistance because liver fat increases. Then it leads to pancreas insulin resistance and pancreatic beta islet cell death, and also leads to fat cell, which can also lead to many complications like I just showed you. So again, this is the quad cycle hypothesis. And this all lead to eventually insulin resistance. And many times, diagnosis of type 2 diabetes follows after the insulin resistance. So again, first the insulin resistance comes, and then the type 2 diabetes comes. So again, the sugar goes up after the insulin resistance has developed. So again, the main issue is insulin resistance, not the sugar. And the reason I said that, because when we talk about treatment of type 2 diabetes, remember sugar and A1C is a secondary target or secondary goal of treating type 2 diabetes. The primary goal, the primary treatment should be towards reversing insulin resistance, reversing insulin resistance. Remember that, and I'll cover this topic as we go, but remember, the primary issue is insulin resistance, and sugar goes up because of insulin resistance. So again, insulin resistance is the root problem. This slide clearly shows what I explained you already. You can see the yellow part, which is the intramyocellular lipid, which is essentially the fat in the cell. And that fat in the cell will lead to insulin, which you can see the blue keys not attaching to the lock, the red one, properly to the cell. And that will lead to less glucose or less sugar entering the cell. And this is the slide of insulin resistance. Again, fat in the muscle cell, fat in all the cells of the body. Again, there is a second theory which essentially says that if you have high circulating insulin, it can lead to downregulation of insulin receptor, and that can also cause the insulin resistance. It makes sense theoretically that when you have a circulating any hormone, just like we develop antibiotic resistance, when you have antibiotic circulating in the blood, the bacteria develops antibiotic resistance. Same way, I can understand that high levels of insulin can lead to insulin resistance from downregulation of insulin receptor, but this theory is not as proven as the theory of fatty acid getting in the cell. In my opinion, fatty acid getting in the cell makes more sense. So again, if I summarize, this is the way I've read, essentially insulin resistance happens because fat where it does not belong. If you remember 1 or 5 words, 1, 2, 3, 4, 5, 6 words, 6 words, fat where it does not belong, fat where it does not belong, fat not in the muscle cell, fat not in the liver cell, fat not in the pancreatic cell, fat not in the adipose tissue. So again, if the fat is in a subcutaneous tissue, you're okay. Subcutaneous fat typically is very benign. It's just like a layer of protecting you, layer of giving you the thermal effect. But fat in a visceral area around our organs, fat in the muscle cell, fat in the liver cell, fat in the pancreatic cell, fat in the adipose tissue is very unhealthy. So again, fat where it does not belong. So again, this is the important slide. I took it from a book called Mastering Diabetes. This is a very busy slide. I could not find a colorful slide, but I'll read it to you how bad the insulin resistance is, So insulin obviously can lead to type 2 diabetes. It also plays a role in type 1 diabetes. It plays a role in type 1.5 diabetes, gestational diabetes. Insulin resistance can cause many cancer, which we'll cover. It can cause coronary heart disease, means heart attacks. It can lead to high blood pressure. It can cause a lot of plaque buildup. It can lead to high cholesterol. Obviously, it can cause obesity. It can cause fatty liver disease. And fatty liver disease now is the commonest reason for liver transplant in female. And even in male, it's becoming very common. So again, insulin resistance can lead to cirrhosis, can lead to liver failure, even may require liver transplant. It can lead to chronic kidney disease, many dialysis, polycystic ovarian disease, a lot of infertility, a lot of Alzheimer's disease. Matter of fact, Alzheimer's disease is called type 3 diabetes. So again, people who have insulin resistance will eventually start losing their memory, will start developing dementia, will start losing the brain function. It can also lead to neuropathy. That means numbness on the feet, and it can lead to many injuries. You will not be feeling if you step on a nail or if you step on any sharp object. Very, very concerning. It can lead to amputation. Insulin resistance can lead to blindness. Insulin resistance can lead to erectile dysfunction. So again, insulin resistance, multiple bad, unhealthy effects. Prevent the insulin resistance by all means. And remember, again, I keep repeating myself, insulin resistance happens because fatty acid in the cell. How does this fatty acid get in the circulation? It's because we eat a lot of fat, a lot of saturated fat, a lot of caloric excess, which turns into fat cells, and that keeps secreting fatty acids. So again, we need to cut fat in our diet. I'll show you what the macro ratio should be, what kind of food we should be eating as we go towards treatment of type 2 diabetes and treatment of pre-diabetes. I'll also show you how you can reverse type 2 diabetes, how you can reverse pre-diabetes. Again, reach out for our coaching program. I have set up a great coaching program for type 2 diabetes and reversal of type 2 diabetes. So again, this concludes the segment. This is the reflection that would you agree after listening to this segment that it's a fat in the cell which causes the insulin resistance? If you have any questions, you can always ask me. But again, it's a fatty acid in the cell. Do you agree that Americans and most people in the world are eating excess calories, excess saturated fat, a lot of simple carb like white rice, white bread, a lot of cookies, a lot of cake, and a lot of processed food, and that's the reason obesity and type 2 diabetes is happening? And what do you think is the solution to our obesity and type 2 diabetes crisis? Again, these are some quick questions. Answer yourself, obviously. Ask me, reflect on it, read about it, watch more YouTube videos, but definitely have these answers. Again, we have this health coaching program. I posted on our Facebook today, different kind of programs. We have like a bronze program, silver program, gold program, diamond program. They're all different costs and different kind of involvement from a coach. One program actually gives you, 2 hours of talk with me in a group Zoom, 2 hours a week. 2 hours a week, if your cardiologist talks 2 hours, pretty expensive, but you'll be part of your program. You will have a constant hand-holding from our health coach, Anna. I mean, if you meet her, she's one of the smartest person, hardworking, very sweet, very experienced. She was a personal trainer herself, so I have full faith and full trust in her that she will help you. She will advance this program. We'll be starting July 1st, so reach out. So see our Facebook post from earlier today. If you are interested, please reach out. Again, this is the end of segment 4. We will be starting segment 5 and segment 6 tomorrow. These 2 segments, segment 3 and segment 4, will be on YouTube, hopefully tonight. So if you need to watch it again, you can watch it again and again. If you have type 2 diabetes or if you have pre-diabetes, definitely watch all the segments at least 2 or 3 times to get the full understanding. I put in about 30 hours of reading, 40 hours of reading, probably 50 hours of YouTube videos, a lot of books, a lot of textbook, a lot of my lifestyle medicine for the last 4 years, a lot of my cardiology knowledge for the last 25 years, a lot of my medical school knowledge, obviously, doing since I was 18 years old. So there's a lot of information which I've packed into 4 hours, 4 hours. So everything you need to know about diabetes is in 4 hours. So please take advantage of it. Please watch all 4 hours. Now they will be in segments, half an hour at a time. So watch it 2 segments at a time, but finish all the segments. If you like what we are doing, invite your friends who like our Facebook page. Obviously, you can do invite one at a time, or there are a lot of ways of inviting a lot of friends. So I urge you, I request you, I kind of ask you, please advise, please invite your friends and family to like our page. They will benefit from what I do every day for healthy lifestyle. We are also on Instagram. We also on YouTube. Reach out to our YouTube channel, Healthy Living with Dr. Aajay Shah. We have a lot of videos now. We have about 30 or 40 videos. Watch as you have time. We have video on sleep. We have video on fiber. We have video on healthy eating. We have video on exercise. Just all different. We have video on happiness. We have all different videos. So please watch those videos. Have your comments. Have your questions. I definitely take every comment and every question very seriously. I always answer all the comments and questions. So please reach out to us. So again, this concludes segment 3 and segment 4 on diabetes. We already have segment 1 and 2 on YouTube. This segment 3 and 4 will be on YouTube hopefully tonight. Hannah is already on it, our social media director, social media manager. So it will be on YouTube. Spread this YouTube videos to your friends, your family. Invite your friends again. Reach out for our coaching program. I have posted how you can reach out to us on today's Facebook post. So scroll on our page and see what we offer. I definitely can tell you it's one of the most cost-effective programs. I have zero profit for myself. All my time is a service to the community. Only reason it costs is because I'm hiring an employee. I'll be doing a lot of, I'll be buying a malpractice insurance for our company. I'll be buying a malpractice insurance for that employee. So that will cost some money, and that's the reason the cost is there. Otherwise, I would do it free. I've done all this thing free for the last 5 months. I would like to continue doing free, but now we are growing. So there is some cost to this lifestyle movement, and I'm only charging you what is going to cost me. My time, my service, my dedication is free to all of you. I'm going to do it until next 50 years. So please join, check out what we have to offer. And if you like it, text or call Hannah and she can help you out. Thank you again. Have a good evening. And stay well, stay safe with this COVID-19. Wash your hands, wear your mask when you go out, and definitely keep the social distance. Thank you again and good night.